I'm Robert Fabricant, the founder and medical director of Pacific Eye Institute. When I was in training in the late 70s, patients undergoing cataract surgery underwent procedures lasting 30 minutes and were hospitalized for 2 to 3 days. Today, patients undergoing cataract surgery undergo procedures lasting 5 to 10 minutes and stay 2 to 3 hours in our facility. These procedures are sutureless, the cataracts are removed and replaced with artificial lenses. These lenses have styles that you'll see in this video, sometimes multifocal and some of them are toric. You will meet the doctors of Pacific Eye Institute. It is our hope that your decision to proceed will be made better informed.
7 years ago, my left eye developed a cataract. It was though a piece of waxed paper was put over my eyeball. I contacted Pacific Eye Institute, made an appointment, and met the staff. The staff was very professional. I then met Dr. Robert Fabricant, who performed the cataract surgery. There was no pain. It was a perfect operation. 2 or 3 days later, I was pronounced healthy as could be. I could see clearly, no wax paper over the eye. Some 2 years later, my right eye developed a cataract. Back came the wax paper in the other eye. So to whom would you go? You would return to the fellow who did a great job the first time, and I came back to Dr. Robert Fabricant. He did an outstanding job on my other eye, and today I can see clearly. I enjoy swimming, biking, and running, and I do that as a sport, triathlon. I was not able to swim or bicycle or run after the cataract surgery, but within 4 weeks I was back to all 3 sports. And ever since then, I've been able to clearly see underwater to make sure there are no sharks.
Hi, I'm Dr. Andrea Ching. I'm one of the cataract and anterior segment surgeons here at Pacific Eye Institute.
Hi, my name is Dr. Rich Roski, and I'm one of the cataract surgeons here at the Pacific Eye Institute. I certainly appreciate you taking the time to watch this video in order to learn more about your cataract surgery.
Hi, I'm Dr. Song Snand, one of the cataract and refractive surgeons here at Pacific Eye Institute. A cataract is a cloudy lens. Normally, when you're born, the lens inside your eye is clear. Then, due to a variety of factors, which includes ultraviolet exposure, trauma, medications, nutrition, genetics, the lens starts to become cloudy.
However, the most common way to get a cataract is merely by living long enough. Not everyone will need cataract surgery in his or her lifetime, but statistically, by the age of 65 or 70, most people will have the beginning stages of a cataract.
As the lens becomes more and more cloudy, it can start to affect your vision. Cataracts can also cause double vision or make colors appear to be faded. You may notice that when you're driving, you need to get closer to street signs in order to be able to read them.
Most people would like to know how a cataract surgery is performed. Years ago, we would have to wait until a cataract was very ripe or very large in order for it to be removed. And this was because a very large incision was made on the eye.
Nowadays, the surgery is done relatively quickly and with very small incisions.
Cataracts are now removed using a process called phacoemulsification. A small incision will be made on the side of the eye in order to enter the area where the cataract has formed. The cataract is removed by breaking it up into small pieces using an ultrasound. After this is removed, a small intraocular lens implant will be placed into the eye.
If there were any difficulty with the operation, for instance, if we had trouble either getting the cataract out of your eye or placing the new lens implant into your eye, either of these things could require additional surgical procedures. Now, the risk of this is also very small, less than 1%. In spite of this being a very safe process, there are potential risks involved. The first risk I'd like to talk about is that of infection. The risk of a serious infection after cataract surgery is approximately 1 in 3,000. You will be on antibiotic eye drops before and after the surgery in order to minimize this risk. Other things that you can do to help prevent infection are keeping your hands away from your eyes. Please do not touch or rub your eyes for several weeks after the surgery. If you were to have a second condition in your eye other than a cataract, something like, say, macular degeneration or glaucoma, this could limit your vision after the surgery. Consult your doctor to see if you have a second condition that could impact your vision after the surgery. Your doctors at the Pacific Eye Institute are committed to providing you with the simplest, safest, most enjoyable surgical experience possible.
The decision to have cataract surgery is based on your needs. If you're happy and functional as you are now, do nothing. If your vision is troublesome and you need to see better, it's a procedure that can be of great value.
I'd like to take a couple of minutes today to talk to you about an exciting new technology we have called multifocal intraocular lenses. Now, the way multifocal intraocular lenses work, as light passes through a multifocal intraocular lens, the light is actually bent to come together in 2 points. Now, typically what the cataract surgeon will do is they will pick a power of a multifocal intraocular lens, which will put one point at distance and the other point at reading. In so doing, you have the chance to have great vision for both distance and reading without wearing glasses. There are several points about the multifocal intraocular lenses that you need to be aware of. The first is that your insurance will cover the cost of the procedure and the price of a standard monofocal lens. They will not, however, cover the price of a multifocal intraocular lens. They consider this to be a cosmetic upgrade to the procedure, and therefore the cost of that part of it will be transferred to you. Other things to be aware of are some patients describe some mild glare after the procedure. This is most prevalent in the first few weeks after surgery and gets better with time. If there should be a slight residual refractive error after the procedure, there's a chance that you could need laser surgery to enhance this. This happens in less than 5% of patients.
Hi, I'm Dr. Jesse Dovich. I'm a new associate here at Pacific Eye Institute. My specialty is cataract and refractive surgery. Today I want to talk to you about toric intraocular lens implant. Toric is a new technology that we have available to us here at Pacific Eye Institute, for which we can offer patients that have high astigmatism measured preoperatively. Astigmatism is the eye's inability to generate one single focal point of light as the light enters the eye to focus on the retina. For patients that have astigmatism, this does not happen. What happens in astigmatism is either the light comes into the front of the eye and it focuses in front of the retina and behind the retina, or it focuses in 2 separate points in front of the retina or in 2 separate points behind the retina. Overall, astigmatism creates 2 focal points instead of 1. With the new toric lens implant, what is occurring is this implant compensates for that problem that the cornea is having by not being completely spherical, and it generates one single focal point that allows the light to focus onto the retina. That is why it is proven to increase your visual acuity after cataract surgery, because it is eliminating the eye's inability to focus the light into one focal point, and it is enhancing the overall refractive error of the eye. Thank you for allowing me to talk to you about cataract surgery and the benefits of toric intraocular lens implantation. If you have any questions, please don't hesitate to contact me or any of my colleagues here at Pacific Eye Institute.
My name is Jeff Mendenhall and I work for a local Inland Empire police agency. I'm a captain at that agency, and I'm here to talk about Dr. Fabricant and the surgery that he's performed on my eyes. I've wore corrective lenses for just about all my life, since 5th grade, and I've worn contact lenses for most of that time period. Dr. Fabricant was recommended when I started to develop pain in my eyes and my contacts wouldn't fit, and I didn't have the visual acuity that I wanted. Dr. Fabricant did some tests and determined that I had keratoconus. This started about 10 years ago, and since that time I have had both corneas replaced, and I've had cataract surgery in both eyes, and today I'm proud to say, and I'm glad to say, that I can see without corrective lenses and my vision is 20/30. Dr. Fabricant saved my career. I actually had gone to the police chief and told him of my medical condition and told him that I was not able to perform my duties anymore. And he said that if Dr. Fabricant could fix my eyes, that he would work with me and that I would be able to maintain my chosen career. I'm proud to say, and I'm happy to say, that Dr. Fabricant was able to correct my eyes, and I've now had this career for over 22 years, and this is where I plan on staying and retiring.
In this video, you have seen how cataracts are removed and replaced with intraocular lenses. If you have any questions, please do not hesitate to contact me or any of the doctors at Pacific Eye Institute. It is our mission to provide the highest health care available. Thank you for your confidence in choosing Pacific Eye Institute.